Yes.
My question is this regime enough? If we follow this regime of exercises every day, 5 days a week, is this enough?
It's a good start, and you'll notice in that regime, there's level 1, level 2, and level 3. As you get to level 3, yes, because there are some weighted exercises in that. Okay, and remember we mentioned that doing resistance training as well as aerobic training, so you want to, quite a bit of that is resistance training, so doing a walk along with that.
Now the second, sorry, first.
No, just asking about the walking. The amount of walking or the distance covered or the rate of walking, which is more important?
Again, it depends at what level you're on. Certainly getting the distance, but then as you get to that, if it's 1 kilometer, then build up your pace as you get more and more fit. If you can do that 1 kilometer in 15, 20 minutes the first time, build it up, increase your rate.
Any other question? Type of exercise? Yes.
Where does yoga fits here?
Actually, it's a combination, it can be a combination, depending on the type of yoga you're doing. Because a lot of the poses can be strength training and the flexibility, and some of the yoga, as you're doing them, if the pace is high, it can combine all 3.
Only the type of exercise, question, please.
Are there specific types which are of maximum benefit to, say, diabetics or people with CVDs or so on?
CVD, is that?
Cardiovascular CVD.
CVD, okay. Certainly, I would start with aerobic exercises, but then you add the resistance. I think sometimes we all start with aerobics, but then we don't add the resistance. And the resistance works in complement with the aerobics, so both are important.
I don't understand this.
Medical condition, sorry, if you have question, type of exercise?
Yeah.
Yeah.
Is the aqua fitness is a part
Yeah.
of that?
Yeah, Aquafit allows you not to put the pressure on your knees so you can exercise. And with the resistance of walking in water or doing those types of things do help both aerobic and muscle building. And
I have a question. I have severe stenosis in my back, and I started like a very mild yoga exercises, and I did it for a couple of months with my physician's advice. I consulted her, but even then I developed some sort of problems. Can you suggest? And then she referred me to the specialist, and he said no, that triggered my nerves, which causes the, after these exercises, and I'm not supposed to do it. So if somebody has a medical conditions like that, what type of exercises we can recommend?
with back, often starting off with some stretching of the lower back. And a physiotherapist can guide you quite well with this. And as time goes on, they'll do something to help improve the musculature and the strength of your back.
Nishma?
On the medical condition, as we get older, the kidney function drops. What exercises do you recommend for helping maintaining but improving kidney function?
As both aerobic and resistance training is important. Now, as your kidney condition gets worse, oftentimes, as Dr. Jindo can attest to, we try to decrease the protein load. So that reduces your muscle tone, and that's important for the kidneys. But doing some resistance training along with aerobics will help maintain the musculature so that you're able to function. In terms of specifically saying this will help the kidney, I don't know if there's anything specific to that.
Vishwa, I can answer, and I think everybody should know this, because I'm not going to open my nephrology clinic in the hospital, in the temple, I mean, sorry. But that's what is happening. I saw 2 patients last week with a kidney problem, and I think the general information, when we cross the age of 40, just remember, as we cross the age of 40, the kidney function may go down. 1% for every year after the age of 40. So you go to the doctor and the doctor says, your kidney function is down to 60. Now, it's a panic button. You know, the kidney function from 100 now down to 60. But then you say, well, look, I'm 75. That is what I should expect. It will take a lot of load off your mind. That's normal. Second thing, your question, how do we improve the kidney function? Don't stress the kidney. That's the only thing that you could do it. And how you stress the kidney. If you do something, the kidney has to work extra. And how do we do it? Food. The high protein intake, high fat, high amount of food, kidney has to work extra. And we caution them, be slow, especially on certain type of proteins. And that's the only way you can slow down the progression of kidney disease. Is there any physical exercise? The answer is no. Does that answer your question? Yeah. Okay. And I think we all should know that as we get older, and this is a message that we have been conveying through Kidney Foundation, that as we get older, the kidney will go down, don't panic, and so long as you know it, and it helps a lot. You have some, Ram? Can I ask you to come up here? Please come.
You talked about benefits. Are there any hazards?
Yeah, I'm coming to that.
What's the
I'm
medical-
coming to that. I'm coming to that. Now, when you talk about the medical condition that benefit from exercise, Sandeep has already covered, and I'm not going to bring it up, but let's move on to the next one, and he also covered this, how to start and maintain it. And I come back to this. I'm not going to talk about weight control, which he mentioned, but I have a question. Less calories, that means less diet, or more exercise, which is the one. Most people, not more, many people come to me or talk general. Enjoy your life, do extra hard work. That means eat more, go to the gym and do exercise. I think this is a common statement. It's not for you and me. If you take patients in the hospital, they say the same thing. I'd like to hear your comment.
In terms of weight loss, 80% of your weight loss is by diet. 20% is by exercise. So if you think you're going to be able to exercise your weight to lose weight so you can eat all the laddus, jalebi that you want, good luck, because it's never going to happen. So you have to control your intake. Like I said, for most of us, an hour of exercise means 350 calories. Like I said, 2 cookies, you're done. Okay? So it is important. Exercise should be looked as a way to stay fit, stay healthy, improve your quality of life. Diet is a way to lose weight. Of course, there's overlap, but it should be the diet that you concentrate on.
I see now in the audience a person standing, and he's a kidney specialist. Dr. Biani, is there any exercise that can help the kidney function? Dr. Biani? is the director of the education program at the in the Kidney Institute. And
So as earlier mentioned by Shiv,
louder, please.
yeah, as earlier mentioned by Shiv, like with regards to the kidney function, there is no specific exercise, but like preventing kidney dysfunction from conditions like diabetes, hypertension, like generalized maintaining a good endothelial health, like that would be any kind of exercise would finally basically help the kidney function as well by preventing conditions like diabetes and hypertension. So as such, there is no specific exercise for kidney dysfunction, like to prevent it, but like having a generalized healthy lifestyle is the way to go.
I just want to mention here, we all do it innocently, but there's a serious implication, and let me tell you what it is. You eat more, you like it, put on a little weight, but you don't know what else is happening. You use the word burn calories. We heard it so many times. When you burn something, what comes out? Smoke. When you burn calories in your body, there is a machinery called mitochondria. You may have heard of it. If you feed mitochondria more food, you'll produce more smoke. And what is that smoke? Technically, scientifically, oxygen. It carries oxygen radical. And if you eat more, you are producing more oxidants. And what do the oxidants do? Damage your DNA. So when you see, as you heard, fat people, no disrespect, they are fat cells. They are the people who have high risk of all these problems, and they are genetic markers, genetic mutations. That's what I'm talking about. So I will urge you, cut down your intake for many reasons, and don't do this. Eat more and do a little more extra gym. That's very detrimental. We talk about the prevention of disease, and Sandeep has mentioned risk factors. He listed all of that. And exercise does good to all of them. You take blood pressure, the diabetes, the obesity, on and on. And before you damage your blood vessels and organs. And if it does happen that your organ is damaged now, as pointed out, then there are exercises which he pointed out. So, same goes for the deterioration. That's the third part, that if the disease has happened, what do we do? And he has covered it very elegantly. So with those questions to Dr. Sandeep Nagpal. Yes?
You mentioned about fatigue, cancer patients.
Yes.
With fatigue, doing exercises is difficult, right? What is your answer for that?
Even if you can do 5 or 10 minutes, there is a benefit to that. So yes, it is challenging, but we talk about the 150 minutes a week. That might not be realistically possible, but even if you do 10 minutes a day, that will help. And in terms of, and again, if that helps their sleep, helps their sense of well-being, they'll be more encouraged to keep doing that. So,
Like what type of exercise?
oh, walking would be sufficient. Is more than adequate. I would probably start with walking with somebody with cancer, actively being treated for cancer.
Question, what are the problems with exercise? Dr. Raman's question.
Yeah.
Especially somebody had cases where the aneurysm bursts. So you don't know what is happening inside you.
Yeah. When you talk about, whenever in medicine, we talk about medication versus a risk, if you're gonna say, give me something that has absolutely zero risk and all benefit, there hasn't been anything found. So we always have to look at the evidence to see what is the risk of overdoing it, causing damaged muscle or something as serious as an aneurysm compared to all the benefits. Okay, so you have to balance it, and we all do it. I always bring up the example of the news. When we see the news, we hear about the person who's done something horribly wrong, car accident. We don't hear about the 99% of people who did the right thing, took care of their children, did all those things, but you hear about that 0.1. I'm not dismissing what you're saying, but the benefits far outweigh the risk that is involved with that.
Should we not consult your physician?
Yes.
All the time, because what many exercises do.
I think that would be important for everybody.
Let me, probably you got the question Dr. Rahman has brought up. Let me expand. All of us, when we develop disease, there are two stages. The disease is developing inside, and I don't feel it. You think it's such a thing? Of course it is. Disease is happening inside, I don't feel it. The term is subclinical. Sub, under. Clinical means we don't see or feel it. That's the most common. Then it is what you see, you feel, and we can diagnose. That's clinical. So his question was, you're doing exercise and you have aneurysm. Now what is aneurysm, in case you don't know? It's the ballooning of the artery. It can happen anywhere. We're talking most of the time in the tummy, main artery. Will it hurt? That was the question. And it can. Should we ask our family doctor or doctor before we do exercise, is it safe to do it? I think it's a good point. I certainly will recommend, but there is no guarantee. Subclinical disease means that you don't feel it and the doctor may have difficulty to diagnose. Any other question? Please.
Dr. Sanjay Gupta of CNN Network recently visited Okinawa to find out what is the real cause for these people who live long. And he came with 3 factors: diet, as you know, exercise, moderate exercise, and mental makeup. But he implies the most important factor there is diet rather than exercise anything. And another study shows that in Okinawa itself, in the last 10 years, they have lost the average life expectancy, and that is attributed to bad dietary practices copied from Western civilization. So any comment on that?
As we discussed in terms of weight control, yes, weight control is mostly diet. Yeah, diet has a huge component in our overall health. I'm very passionate about exercise, and I think everybody should be doing it who is capable and willing to do it. But it's not the be-all and end-all. There's other aspects of our lifestyle, and diet is a significant component of that. And yes, diet is important.
I just want to mention what the question is. There are communities around the world who live much longer, over 100 years, more than anywhere. These are called blue zones, and there are 5, at least 5 that I know around the world. So the question was, one of those, Okinawa in Japan, what is the secret of living longer? And he mentioned the diet and this and that. And I just want to tell you, one of the sessions in the next few months, we are going to review all these 5 blue zones, just for your information. What is so unique about them? That they live much longer And surprisingly, they have no heart disease, no dementia, no diabetes, none of that stuff. And so I got details about these 5 communities. So I'll have to find time to prepare for you. Maybe over the next few months we'll do it. Any other questions? Yes, please.
There is a lot of controversy about milk, so one should drink it or not, or all that stuff.
We are talking about
What does it say?
exercise.
Vegetarian or
Okay. We are talking about exercise and
diet?
and diet will come when we talk about later. But just to answer your question, in moderation, everything is good.
Just to add to that.
Related to exercise.
Okay, sorry, I'll just add to what Dr. Jindal just said. The dietitians have a saying, there's no such thing as bad food, it's bad quantities. Okay, so keep that in mind, no matter what you eat.
Yes, sir?
Yes.
I have a problem with the food, soul of the food. There is some callus type of corn problem. I talked to my doctor, he said the more walking is harmful, or it may be orthotic problem. So what is the relation between walking and the orthotic problem?
That you may have to see, I don't want to override what your doctor says. He knows your medical history. But if you are developing calluses, you may want to look at getting orthotics to help improve the pressure point so you're not getting a pressure point in your foot. So,
How they are related with the walking?
because if you're walking, it puts certain pressure points on your foot. Your weight may not be distributed evenly through your foot. There may be one area where you're getting more weight on, and that's causing a bit of a callus.
I don't want to, I think you all know it. It's just a reminder. Talk to the hockey player. Their cartilage is gone. Talk to squash player. The disc is gone. These are the negative sides of doing exercise up to that degree. So nothing is safe. But if you do it with knowledge, that gives you where to stop. I think that's the point we are making it. If you're developing callus, whatever the reason may be, I think the exercise may cause you pain. So you won't do it. Yeah. Any other question? Please go ahead.
Any significance on what time you do exercise during the day?
Everybody has their own rhythm of what time is the best. The only thing I do suggest is not do it 2 hours before you go to bed because you won't sleep as well. That's been shown. But some people, their energy level, you always hear, I'm a morning person or I'm not a morning person. What works for you? Because again, like telling somebody you have to swim, they dislike swimming. If I tell you you have to exercise at 5 in the morning before you go to work, that doesn't work for you. Okay, so whichever time works best for you, but fit it in sometime during the day.
Have you heard anybody circadian cycle? What is it?
I've heard that, I don't know it.
Okay.
It's your body's biological clock.
Yeah, biological clock, but you must know what it does. Morning is the worst time. I'm going to come. Most of the heart attacks happen in the morning. Most, not all. Chest pain, angina, heart attack, strokes happen in the morning. You try the blood pressure machine for 24 hours. You don't know what's happening. The machine is recording. You wake up in the morning, your blood pressure is very high. But not high, very high, it's high. Your heart rate is high. So these are the sort of things we measure. Now when you measure the hormones, your epinephrine, norepinephrine is high, your cortisol is high, there are many other things. So the worst time is in the morning, where the circadian cycle hits you the most. Now, as for the exercise is concerned, I'm not familiar that you can do exercise and do harm morning and evening, I'm not familiar with it. Mohan, do you know anything?
No, I don't.
Circadian cycle? No?
No, not with exercise. It's just the 2 hours before bed to disrupt your sleep. And we're finding more about the circadian rhythm. We've known a long time about blood pressure and heart attacks and strokes, but actually I was just at a talk recently, they were talking about asthma has a circadian rhythm as well, which is, so there's a natural ebb and flow through our bodies. Our bodies are not constant beings 24/7.
Any other questions related to exercise?
I have one very important. I am a diabetic. After I do my exercise, my blood sugar, if I measure the sugar, is high.
When is the blood sugar high?
After the exercise, because I do some vigorous yoga and exercise. Once I finish that, if I measure my blood sugar, it is high. Not very high, it peaks.
Well, you know the answer to that, and of course being a doctor yourself. And see, during exercise, there is a little bit stress element. You release epinephrine. And you know, you heard about it. When somebody's blood sugar drops, what do? We inject glucagon. It mobilizes